I'm Dr. Ina Marcus. I'm a pediatric ophthalmologist, and I specialize in pediatric ophthalmology and adult strabismus. People oftentimes talk about, lazy eye, and lazy eye is a common term. It can really mean three different things. It can mean amblyopia, which is a lag in visual development. It's a problem where the pathways in the brain for one eye do not develop as well as for the other eye. It can be due to eye muscle misalignment, strabismus. So sometimes people say that a child or an adult has a lazy eye. One eye is looking at you, the other eye is looking in towards the nose, or is wall-eyed or looking somewhere else. And the third thing would be a droopy eyelid, which can also cause amblyopia in itself, but is not necessarily that. So it could be a weak eye muscle, it could be neurologic, it could happen due to a variety of things. And I do see children and treat children with ptosis, a droopy eyelid. And it's important to monitor them for an interruption in visual development and problems in seeing, amblyopia specifically.